Hi, Fabien. Welcome. So today we have our guest. His name is Fabien Hronec.
You got it.
Yeah. So if you guys are looking him up, it's Hronec.
Perfect.
Correct?
Yep.
Okay, correct. Epigenetics is something huge that's been questioned with my patients. They wanted to know more about it. We all know about the gene pool. We think that we're predisposed to a certain body type. Our parents were heavy. So, okay, tell me if I'm right or wrong. If you were to date a girl, you would go and look at the mother and see what the mom looked like and think, okay, there's the gene pool. But nowadays we know epi means above genetics, that our environment, what we take into our body, so on and so forth, can change that. But wasn't that a thing? Like when you were younger, in your teens, would you not look at the mom and kind of like joke around and think, okay, that's what they're going to turn out to be?
That's what I was always told. The mom, you can look at the mom and expect how they're going to turn out. And then I have a mentor that started to teach me that genes are from your father. So like a lot of your character traits will come from the dad side. So I think it's more of maybe the physical side, the way they look for sure.
Right.
But yeah, it's super cool because it's your environment and how it affects your genes. So they did this really cool study where they realized that 98% of your genes change based on your environment.
Right.
And the way they did is they took twins. So they did studies on identical twins and they said, all right, well, let's not purposely, but let's send one to a broken home, one to a happy home and study them. And the difference was huge. Like, why would they have different disease states later on or different health if they all have the same DNA? And that's where they realized that there's only 2% that's set. And that's like our eye color, hair color, skin color. That for the most part won't change.
Your hair, if you get alopecia, your hair falls out. They usually look at the mom's father. So with stem cells, though, I know the babies, when, let's say the mom has a baby and they're taking the stem cells, it's actually coming from the baby, right? So that's the umbilical cord. But they say that the mom gives the majority of the DNA. So I'm going to have to look into that. I'll clarify that.
Yeah, so I'm wondering if it's what he's talking about. My mentor was more about if it's DNA specifically or if it's a certain character trait that you inherit because it goes back. It's interesting.
But I know you're very accurate. It's only the 2 to 5% that you end up having that predisposition of the genes from your parents. So that is really good news. We don't have to think this is all that we're capable of. And our parents could be fantastic. My parents are fantastic, very blessed, right? But it's also about, again, your environment. I worked at Moffitt Cancer Center. We learned that we all carry cancer cells within ourselves, right? And there's 5 commonalities that turn on or turn off these gene sets and cause these DNA, everything to kind of react and for the cancer to start replicating. So it could be exposure to carcinogens, right? If you're just smoking or if you're a firefighter. I used to do high-risk physicals for firefighters.
Yep.
And it was incredible to see because they were exposed to these carcinogens. They had so much more likely to have cancer. So we would do scans in their body so we can catch it early.
Yeah.
Prostate cancer, kidney cancer, it was unbelievable. Thyroid cancer, and they could be young, but that was one of the factors. So it's things like that. Stress is huge, all that cortisol and stuff. So with your company, you talk about detoxing, going through purifying all the way down to the cells, that's not a word, getting rid of all this junk we're putting into our body.
Right. Yeah, that's a huge focus of ours. Detox is what we specialize in, and it's because of how many more environmental toxins we're exposed to all the time now. But firefighters are a perfect example because what they're finding out is that there's no real protocol to clean all the equipment as well as they should. So they're putting on coats that were in a fire
exposed,
and they're putting it back on again, right? Or they're setting it in their fire station and it's just leaching toxins out into the fire station.
And they're there all day, all night.
Yeah. And not every place where Like different county has all the same stuff to help prevent that because they have special lockers now. They have disinfectant protocols that they do. And so it's the reabsorbing of the toxins that's becoming a big issue because it is absorbing into the material. So we decided one cool way to help these firefighters detox is we created a rapid detox protocol.
So you actually, oh my goodness, I didn't know that. So you actually have a protocol, you've interacted with them?
Yes.
Oh, wow.
Yeah. So
this is so cool.
48 hours. The goal is as soon as they've been exposed to a fire, they need to come in and we do several different things.
Okay.
And by doing that, our goal is we're trying to get the toxins to flush out of the system before they absorb into the tissue, where it becomes more of now it's a little more difficult to get rid of it. Right. And so they come in and it's really cool because they come in, they focus on what's called exercise with oxygen, which is saturating the body through the lung with oxygen.
Mm-hmm.
They drink a mineral solution and they go right into far infrared sauna therapy to heat the body up to help it sweat out. So now we're just, all we're doing is making the body do its own job. And that's ultimately what we're trying to teach and do with the reboot model is we're making the body do its job properly by teaching it.
So is that what it's called? It's called the reboot model?
Reboot U. So the
Reboot U with a U.
Yeah, with the letter U.
Okay.
So Reboot U is the company name. And then the method is called the IDEA method.
It's on your shirt.
It is.
I see that. We're going to zoom in. Okay.
Yeah. And the idea is it's all about teaching your brain and your body to do its own job. And so all the cool therapies and things that we do, the really cool epigenetic testing, which shows what's in your body, because everybody's unique in their own way, which is part of this DNA side, is how do we capture that information? And so there's a really cool German technology that came out where we can finally, I look at it as like a logbook our body carries, and it's in the hair follicle is one of the logbooks. And it's from the last 90 days until that follicle grows out, it's capturing cellular information constantly. So then how do we get to that logbook? And that's where they created a type of scan, a digital scan of the little root that's pulled out of the head. And that's the logbook. And it's giving us a printout of the book and what to do about it. And what we're seeing is, what are you deficient in? So what are you missing?
Give me an example of what it would show that I would be deficient in.
Yeah. So let's say minerals, vitamins, amino acids, antioxidants. So you get to see if for some reason you're missing magnesium or B12, or right now there's all these hype nutrients that are out there, but in general, they all have a purpose to run the body. So they all run systems, and you need a certain amount of nutrients to run protein synthesis, which is breaking down protein. To break down sugar, you need certain nutrients for your brain to function, right?
You know, it's funny because I know a lot of patients don't understand that. So when we're looking, let's say a cardiac patient comes in, right? If their sodium potassium is off, if it's too high or too low, it's actually the electrical pump. So if your sodium is way too low, it can cause an arrhythmia, a VTAC. If patients, anybody out there in the public, they don't realize, okay, I'm too dehydrated, or I haven't been eating a certain amount of thing, or I want to take some Lasix or something to get rid of water weight, and they don't realize what is going on when you're deficient in this, it's going to affect everything.
Yeah, for sure.
So,
because the hydration of your cells is super important. I feel with epigenetics, we can find out the cause really early. So you might do a blood work and sodium is in range, which, you know, we probably both know that slightly out of range still means something. But for sodium to be low out of range, that's pretty dramatic. But we can see sodium much earlier with epigenetics because we're seeing all of the cells. And if sodium's slightly deficient, then you start filling it in so you can get that sodium potassium balance.
So, you know, if it's like criminal cases, they'll take hair follicles because they can see so much and read through that. Same thing with medical. We'll look at that. People will try and skew their test with a urine or do something, use somebody else's, or they can wash out whatever drugs were in there, but not in a hair follicle because, just like you said, it holds on to it. So that's enlightening to know, but it's also, it's encouraging to people that want to give this sample to you because it's not going to be contaminated in the route to get to you because they don't physically have to come to you. They can send in their hair follicle, correct?
Exactly. Yeah.
Okay.
And it's a really strong marker because of that. Yeah. So you don't cut the hair off because that's the shaft and that's a history of what happened in your body mineral wise. So we can see metals and certain minerals, and that's been around a long time, hair follicle testing or hair testing, I should say. So this is the bulb that comes out of the head, and it's scanning that because that gives us all the additional information. It's still alive. The part of the hair that's still alive is where we get all that good info.
Right.
And so this is one reason why I really like the follicle testing, is because when you send something like blood to a lab, there's so many variables that could affect it, right? Like heat, or if
it coagulates.
Yeah, exactly.
Right. So it becomes this big blood clot, and then it's no good. You can't use it. That happens so many times.
Right.
Same thing with the urine. Like things break down or become more acidic just sitting there or something, right?
Yeah. Yeah, exactly. And so the worst case scenario with the follicle is that all male has to go through a X-ray machine. So what we made sure is there's a little radiation proof pouch that the hair follicle goes in.
Okay.
So it doesn't absorb the radiation, which actually shows up on the scan too. You literally see every EMF, ELF you're being exposed to too much of. So if it's cell phone, or if it's Wi-Fi or cell towers, it gives you exactly which frequencies you have more of in your cells. So then I don't think we can avoid it. This is what I've realized. So when I see...
Which part?
We can't avoid electronics, right?
Okay, yeah. Yeah. Well, you can reduce it.
You can reduce it.
Right.
When people I work with say, well, should I just not have my cell phone on me all the time? I don't think it's practical these days.
Right.
So I just let them know, no, we need to figure out why your body's not resisting and eliminating those electronic frequencies like it should. Because sweating, pee, poo, all of that is those are ways that we get rid of these digital toxins.
And there's a lot of patients that have constipation problems.
Right.
Or they don't drink enough during the day. They're too busy.
Yeah.
So they get really dehydrated. Nurses are number one for it.
Nurses are a big one.
So, and then a lot of the patients that are on the GLP-1s that are losing all this weight, it slows down the gastric emptying and everything. So they don't have bowel movements as often. So we can look at that. People that are eating high amounts of protein and they're not getting enough fiber. It's another thing. People that work out over excessively and they don't have time to rehydrate themselves. Yeah. So you'll be able to see all this. Let even me, and it's funny because I can have somebody sit in front of me and just have a consultation with them. And already in my brain, I'm like, I would love to see if it lines up.
Yeah, for sure.
And then also see what even I'm missing, because I think everybody kind of knows, like, oh yeah, and I'm not drinking enough, or they might be overindulging in something and they shouldn't, or they're sitting there scrolling, like they know. But to know that we know that they know that we know, it's almost it's actually causing them to. There's accountability there too, and when it's on paper, I think it becomes more real. People are like, okay, hold on. Now, I don't want to become my mom or my dad in regards to their health history. I don't want to have these cardiac problems. I don't want to be obese. And you don't have to be. And you don't have to be sick. And you don't have to contract cancer. What happens? Or you can at least help prevent it in every possible way. Even if you're predisposed to it, this is something that they can feel they can take a little bit of control over.
Yeah. So this is something that's going to make detox is going to be the most important thing, I think, in the future for healthcare, because there's no way to get away from all of these pollutants and toxins we're dealing with. The stress, unless you live on the mountains somewhere.
Is there anything that's not like so crazy extreme? Because I know there's like the major fasting or like that colon cleanse. I don't want to do that.
You think that's extreme?
Yeah, I don't want to have to do that unless I'm going for colonoscopy.
Have you ever had one before?
A colonoscopy? Yes.
No, a colon hydrotherapy session.
I've had like food poisoning. Does that count?
No, that's the pooping your brains out. Doesn't count.
Okay.
Like where you went somewhere to get a colon hydrotherapy session done.
No.
Okay.
Have you had one?
For about 8 years now, I've had them done. But before that, I had no clue about them.
Like once a year or a couple times a year?
At the moment, it's once a month.
Okay.
Because how else am I going to keep my body up to par? Because you got to think of it. You and I are both professionals. You run a podcast. probably have multiple other things you do
My
besides
practice is huge.
having a relationship on top of everything, right?
Yes.
So think about an athlete, a professional athlete. They have a whole team behind them to make sure that they can perform at the highest level. We're probably doing more than a professional athlete's doing, except maybe not banging our body physically as hard, but we don't have a team. So how are we going to be able to do more than even an athlete does without a team unless we're keeping our body able to handle that? And that's the key. So why do I do a colonic once a month? Because I start to get this kind of weight feeling, this kind of sluggish feeling. I go in and do a colonic, which creates the vacuum in the body. A colonic is where you have water introduced, like an enema, a high-end enema, and you're stimulating the colon to pump, because that's how we poop. It's called peristalsis, right? And the peristalsis can either slow down or it can get to the point where you're dehydrated and then hard waste is getting stuck in there. So I'm helping the body to remember to create that vacuum to flush out toxins. And as soon as I come out of there, the belt goes on easier. I feel lighter. I'm in a better mood from that.
This might be fantastic for all my GLP-1 patients.
Totally. Yes.
Because it does. The glucagon-like peptide, it slows down the gastric emptying so that peristalsis slows down.
Okay.
And a lot of them have at first, when they first started, issues going to the bathroom, having bowel movements because that peristalsis has slowed down, and they have to kind of rearrange their lifestyle a little bit and understand what's going on and they'll use magnesium. We always tell them, magnesium oxide is really good for you. Increase your water, increase movement, exercise. It's very important. But if this is as simple as you're saying it is, walk me through the process so that they can hear and they understand, since you do one a month. Okay, go ahead.
So we have a clinic down in Ocala, right? Ocala, Florida. We have all these really cool things. Hyperbaric. We have IV infusions, EBO2, which is a blood cleaning. Our busiest room that we have is our colon hydrotherapy room. It's booked out every 2 weeks, right?
Okay.
So why? We don't advertise. We just started advertising it, but we never advertised it. It's always been the busiest thing. And so I think it's an instant gratification for one.
It is
because you come out, first of all, you see all the stuff coming out of you, which you're like, damn.
Is it like a clear?
There's a clear tube and it goes through the machine. So.
And they put it in the rectum?
The most awkward part, which everybody's like super afraid of, which my first time I was afraid of for sure, is there's a speculum and it goes in the rear end, right? Sure. So you're fully awake for this. It's not like a colonoscopy, but you lay on your side, speculum goes in the rear end. There's trained professionals doing this. That's super important. And then there's an FDA approved equipment that's designed to introduce water at your body temperature. You can adjust the water temperature, but body temp water goes in. And as it goes in, you feel it. And then eventually you feel like you got to go.
Right.
And there's a signal to that. So it's an A and a B. So B, you have to go. They release the water. And then the water comes out slowly, goes through a tube, through the machine. And our techs are taught how to read what's coming out. New waste, old waste, parasites, yeast colonies.
Really?
You see like corn that wasn't fully digested coming out.
Oh, yeah.
That myth is true. Really?
It is true. Yeah.
Really comes out that way. And then they keep track. And that's how we ultimately know, like, how is your digestive system and your gut functioning? Because if it's all new waste, that's perfect. That's how we know you're fine. You don't need any more colon hydration.
Methylation, I know this. When anything you put in your body, like you were saying, supplements, any type of nutrients, protein, whatever it is, it has to go through a breakdown process.
Right.
And so, it can cause inflammation. If your body is saying, okay, you introduce this weird snow cone, something fried, whatever.
Yeah.
What am I going to do with this? Like no matter what, it still has to break it down. And what it's trying to do is get the nutrients. And I laugh about, we all love corn. We all see it come out whole and we're thinking, what in the world? So I can only imagine all the other, it could be ingredients in food. It could be medications, what's going on in our body, how it's being methylated or broken down, and then also how it's coming out and what you guys see in your testing. So what does that do? Do you analyze that specimen, or is it more of from the hair root? Are you able to read a report off of your text give you, or how does that work?
So I think a good point is like, why would you need colonics and how do you know if you even need it?
Right.
Right. So in terms of a testing side of it, Yes, I see it in our testing. And the way I know is I'm looking for toxins.
Right.
So the epigenetic follicle test shows us if you have mold spores, right?
Okay.
I'll just make that one as an example. Parasites, yeast, if you have bacteria.
That's hair.
That's just from the hair follicle.
Okay, I want to know this. So you guys can get your yeast checked, your
yeast, bacteria, parasites
are huge. I have
Mm-hmm.
a lot of patients that come to me like for ivermectin and other things because they feel like they need that cleanse. So this will be fantastic.
So just know that everybody has these things.
Right.
We all have them. It's just if you have too much of one or the other,
It's not good.
then it starts to cause an imbalance in the gut, right? Now, the cause of mold spores for most people from the data that I'm seeing is a poor digestion of protein in the stomach. And a lot of people, this is going to be a pandemic. You can quote me on that.
Right.
Low stomach acid and the lack of the ability to break down the food because people are go, go, go. Like we're designed to sit and the food breaks down. And with our parasympathetic nervous system, everything's breaking down. 15, 20 minutes after a meal is how long you should be sitting after every meal when you're done chewing to let that turn into a mush in your stomach, the food.
Right.
And then it passes through. And if everything's perfect, then the small intestine will absorb what it can and then it'll go to the trash can and then you're going to poop it out. If the stomach doesn't do it right, pieces of protein that don't break down, it's almost like little sand spurs that go through and it just irritates. That's why the gas and bloating can happen. It's a reaction in the small intestine. So you're like, oh God, what did I just eat?
Yeah.
And then that dehydrated waste that has to, because that has to continue to break down in the small intestine. Now those dehydrated pieces are going to the colon. They're getting sticky and they get stuck to the little, looks like a centipede, your colon.
Sure.
Stuck in the little crevices. And I've seen this physically, so that's why I can say this. People literally grow mold in their colon.
Well, diverticulitis. So there's a difference. You have the outpouching in the colon and food gets stuck in there. And that's what causes the diverticulitis.
Okay.
And that becomes an emergency. You need antibiotics.
Right.
They have to see if sometimes it'll cause like a blockage in there. So this is really important. And we have to tell people no more nuts. You have to be, your corn, your seeds, your everything. You have to be very careful what you're eating because now you have the pouches in the colon.
Yes.
And you're going to be more prone to having this diverticulitis.
Yeah. And we always make that a point to ask those questions in the questionnaire because if you have diverticulitis, there could be damage to the colon wall. So we have to be careful with that. But this is a great way to not only, if you're able to do it with your diverticulitis, which we get to that eventually and we screen you, then to do the colon hydrotherapy is to take out the cause and then allow that wall to heal itself again from it. So it's really important because there's not a lot of other ways to fix the problem. You can avoid it with nuts, seeds, and things. But how do you fix the problem?
Yeah, no popcorn.
No popcorn.
Going to movies. Right. Yeah. Forget it. Like, why go to the movies?
Exactly.
So you can get a colon cleanse. No, you got to be careful. Still be careful.
You still got to be careful, but we've done many clients with it. It's as long as it's under control, it's fine. But diverticulitis is it's a really nasty inflammation
it's really
that you
bad.
notice.
Yeah. I have patients, a handful that unfortunately have this. They have to be careful with taking certain medications, foods. Some of them are not candidates for like the GLP-1s.
Right.
And if they're to that extreme, of course, go see your specialist or GI doctor and go from there, or even get a letter and saying that's fine, colon cleanse. But again, it's more of like doing like an enema to a degree that's in a controlled environment. You guys are watching this and the patient can actually see what's been inside of them and
what's coming out.
And what's coming out of them, which is great. But they have to go to your facility. Now, what if they live far away? Do you recommend them just finding a place where they live to do that?
Yeah. So typically that's what we do now. So if we kind of back up a little bit to what our detox program looks like as a whole, because that's just one tool. Hydrotherapy is a tool, right? Okay. But we still got to get the body to clean itself out. I call them filters. So the liver, gallbladder, kidney, bladder, lung. Yeah. These are like huge filters for the body, right? And just like your car, you bring it to a shop to get the oil change. It's a similar thing where obviously we can't take the liver out and put a new liver in like you do a filter in the car.
Right.
But we can clean it out. And when we do, it's important when you flush out the liver, And this is why it's important you know what kind of detox you're doing.
Okay.
Because you can do a crazy detox, which makes you poop your brains out, which is going to flush all kinds of stuff out of the organs. But then what happens once those are flushed out of the liver? Because the liver literally, if you were to take out, I call them tunnels, but everything that's in the liver, all these tunnels, and you've attached them, there's like 60 miles of tunnels in your liver, right?
Well, it's funny with the kidneys, we always, as providers, we look at the estimated GFR. That's the glomerular filtration rate. And that tells me how well the kidneys are working. And if they're not doing so well, there's chronic kidney disease level 1 through 5. We have to titrate their medications accordingly so that they do not become toxic.
Right.
So we can see that in a blood test. So this is a great opportunity for people out in the public, clients, patients to say, okay, if I was to get this test, I can possibly see what I'm taking in or what's affecting me and what can actually in blood work improve my kidney function by deleting these certain things. So it's just like what you're saying with the liver. The liver is the main detoxifier of everything. Medications, alcohol, you get fatty liver disease. I mean, so it's so important. So important.
So imagine your client doesn't have great kidney function, and then they go through a crazy liver flush or cleanse. And all of these toxins that were stored in there to protect you are now being pushed out. Next stage is to the kidneys. You don't have a good filtration going on anyways. So now you're just clogging the body back up, and eventually you're going to reabsorb those toxins.
Sure.
So with a colonic, what you're doing is you are stimulating the liver. And that's part of where you go in the bathroom in the morning happens, is the liver and the colon connection makes you go to the bathroom. So if you do a colonic, you're stimulating the liver, so the liver knows it can focus on flushing, but you're creating a vacuum, just like pulling the thing out of a tub, the little plug, and now you got this nice whirl drain going. Colonic is just pulling the plug and letting the drain happen. So if you do detox the liver, we do a colonic and start the liver flush the same day. So now the body knows the vacuum and the stuff's supposed to be pushed out of the body.
What's the liver flush? What is that?
So we do an oil that you drink at night. It's got certain things like castor oil, MCT oil, olive oil.
Those will make you go to the bathroom pretty good.
Yeah, but if you lay down right after you take it, it slowly works its way through your liver and gallbladder to purge. So you don't go poop your brains out right away. And that's what we do. So immediately you lay down, so it's right before bed, and now you're flushing the liver out. And when you wake up in the morning, your body can start removing it, but you have a vacuum.
How much do you drink of this stuff? Is it like 30 cc's? Okay, it's a 2-ounce shot.
It's a 2-ounce shot. Yep.
So you can trick somebody and say, "Hey, have a shot with me."
Oh yeah, absolutely. I think you're gonna know.
Yeah. But well, I mean, it's funny because people will put some very hard liquor in their body doing multiple shots. Well, here, have one of these. See.
Yeah, we do have a couple things we mix with it, but like lemon, for example, to help break up and cut the fats.
Right.
But that's typically the liver gallbladder flush, and then always hydration. So the whole detox, 3 kits. Each week you have a kit. Liver gallbladder week 1, hydration, parasite, and heavy metal capsules. So we're getting everything rolling. At the end of that week, you do another colonic. Why? Because you're starting to fill the trash back up.
Yes.
So now we got to take the trash out.
Okay.
Week 2, kidney bladder flush, hydration, colonic.
I think I have all this. I'm going to look.
You do.
I did. I printed it out. Okay.
And then the last filter that we have to clean out, because we're following the body in the way that it synergistically detoxes on its own: lung, heavy metal, parasite again, and hydration. And a colonic throughout each week.
So the lung, there's nebulizer solutions, right? What is in that? Because I know when I give a nebulizer solution, it has, the albuterol. We might do like a concoction to help with COPD. So the albuterol is like the first instant quick, and then we have something for longer to stay in the lungs.
And what's the purpose of that?
Well, the albuterol is an immediate opening.
Okay.
So it opens up the alveoli and it helps them breathe.
Okay, got it. Yep.
And then the other one kind of keeps it open, and they both bring down inflammation. There's also corticosteroids that we'll do in a nebulizer that will immediately bring down the inflammation, but it's not taking away the problem. It's only at that time going to bring it down. So what is the problem? For example, my husband, if he has any type of gluten, if he drinks a beer, pasta, even soy, he'll within minutes start to wheeze.
Yeah.
He carries around an inhaler because of it.
Okay. So besides breaking down protein, the lung is the second most affected thing that I see personally from our scans.
Right.
And I believe it's all comes from the digestion. And that's why he starts wheezing after eating those things.
Sure.
Something's probably feeding the yeast buildup that he has. And the yeast is fermenting. That's how they make beer, right?
So the gas is going up, right?
Yep. So that's fermenting in your body. You're creating your own gas. Mm-hmm. Gas rises, so the body has a choice, and it decides to pull it and drop it at the lung. It's assuming that your lung is going to exhale the bad gas. You breathe in new air to the blood, and it goes to the body.
Okay.
But it doesn't always happen that way. So sometimes the lung gets overwhelmed with excess gas. And that I see that by the lung overworking. That's what I can see in the testing. And then you're not exhaling like you should for whatever reason with the lung. So the nebulizer has something from tea tree. So there's this really amazing company out of Australia.
I love tea tree, like tea tree oils.
Like tea tree oil. So they actually created a way to process the tea tree to where we can consume it at high levels without it being toxic. Several ways without it being toxic.
Okay.
So we inhale it. So it's a solution. You put it in a nebulizer. You inhale it for 10 minutes through a little portable nebulizer. And what it's doing is it's making your lung purge out, which is what it wants to do.
Do people cough?
Yeah.
Yeah, I think that's important.
Yeah.
And people don't realize that. Even when they're doing a nebulizer and stuff, they're coughing up, hawking up phlegm and everything. You're like, you need to get that out.
Yeah, exactly.
It's so important.
Your body's doing that for a reason. Like sneezing. If you ever just randomly sneeze, try to think about what you just did. Is
your environment?
Yeah. Is it somebody walking by with a perfume and it just hits you, you know?
Yeah.
Your body's like, get the hell out of my body. Get out of here, dude. So it's trying to get rid of something. And so that's where we have to support that organ too. And so nebulizing is the key to help get that.
I want to come to your facility. I want to do this.
Will you do a colon hydrotherapy?
Of course. I'm not scared. I had babies. I did, my rectal exams I've had to do. Like the firefighters, unfortunately, and law enforcement, because we would do those high risk, overall assessments on them. And this is going way too far, but one of them is a prostate exam because they end up swelling, got to check for cancer, that type of thing. It's really important. So if I'm dishing it out, I got to take it. That's probably not really nice how I just said that. But yes, I will definitely, I do not like to recommend certain things unless I try them myself. Or if I'm not a candidate for him, my husband, the poor thing, I'll throw him out there as a guinea pig. My friends, my family, because I need that input.
Yeah.
I don't just say, oh, here, go do this to my patients without thoroughly investigating it and understanding it myself. So yeah, I think it would be really cool.
And interesting fact about the prostate, and especially with when there's an issue with the prostate, there's a part of like our colon as a guy at the very end of the colon, it bumps up to the prostate, and then we have prostate bladder. So with women, there's no prostate, so it's straight to the bladder. When you have a lot of waste and poop built up in that last kink there, which you can still go to the bathroom with this buildup, is poop in a small environment creates heat, and that heat starts causing inflammation. So the heat on the prostate for a guy starts to restrict flow to the prostate. And now the prostate, because of that, it could be an issue with low testosterone because now the testes aren't getting the flow that they need. So I saw this for the first time in blood work. This young guy, 29 years old, with like 155 testosterone came in. I'm like, well, that makes no sense. So we went through it. We saw mold spores. We saw poor digestion of protein. We saw an issue with the colon, meaning there was a lot of work being done in the colon.
Feces or just a lot of work?
No, a lot of overworking of the large intestine. We see that with
like an IBS?
It's called a pulse analysis scan.
Okay.
And you have meridians in the body, and that's how you see how the liver's functioning, the kidney, the large intestine, the lung. And so with this test, it's an HRV test, heart rate variable test, goes on your wrists. That one we have to do in person. It shows me if certain organs are overworking. And if they're overworking, that tells me that something's making them overstimulate. Like with a cardiovascular client, a cardio client where their heart rate's raised and it's elevated for no reason, you'll see the heart overworking. You'll see that there's more tension than there should be for a normal functioning heart. Same thing with the large intestine. So when I see those things, I know that there's something going on with the colon. So then what we did is we did 30-day detox, 4 colonics, 90 days later, did the blood work, test levels at 455. Nothing else, right? And that's where I started to learn from my mentor that that's a big reason why prostate cancer happens in older gentlemen.
Do you also monitor their sleep? Because their circadian rhythm is very important. It's very important for their hormones, for regulation, just for the body to work, even going to the bathroom, having a ritual to do that. I can't emphasize that enough, how important. So I always emphasize with my patients, make sure you have like a routine and you're consistent on what you're eating and you're drinking and your hydration and your sleep. Your sleep is so important.
Yeah, I totally agree with you on that, for sure.
Do you incorporate that too? Do you ask them to give a history of what they're eating? I'm sure you do, because you're going to want to know what the inflammation's coming from and why they're...
So we have a questionnaire that we go through.
Right.
So we can get your feedback as well as the data.
Okay.
And you mentioned this earlier. People really do want to see a technology or a testing that tells them what's going on as well. Even if you and I could see them and their symptoms and go, oh, this is what you have, they still want some kind of a tangible evidence
of course they do.
Some validation, right?
Yes.
So the testing
comparative too, Fabien. So they can look 3 months when they start prior to now the present, and that usually doesn't lie. I mean, you can look, because you and I can blow smoke all day towards someone and say, this is, what's going to happen.
Right,
but when they see it, in their blood work, that helps.
Totally. Yep. And so I don't follow sleep. Like, I'm not sitting there monitoring their sleep, but I do ask how the sleep is. And the most important question that I ask is, do you wake up in the middle of the night, and is it consistent? And can you think of when that is? Because in Eastern medicine, your organs all detoxify themselves and work on themselves in a 24-hour clock. So literally from 12 to 3 a.m., your liver naturally on its own detoxifies itself every night if you're asleep. And 3 to 5 a.m. is the lung. So if you wake up consistently at 2 a.m. every day, every night to go to the bathroom, what it is your subconscious waking you up because it can't handle what's happening. Your body wakes you up because it can handle a lot more when you're moving. And it makes you get up to go pee because the liver's like, we need help. And so that could be a reason. It could be many reasons, but that could be one reason why you're waking up at 2 every morning. So if you can find that out, and my scan can show you that the liver is low functioning, your hair follicle test can show that you have high yeast, which is the cause, because the yeast is irritating the liver and you have too much of it to actually process through the night. Now we're figuring out the why.
Right.
Why does somebody have night sweats? Why does somebody wake up groggy like they just had a hangover and they didn't drink?
Right.
The source of why, what's happening in the body, and then the blood work is the end result. So this system is not new, but it's a system that was kind of handed down to me over time. And then I just believed in it as I saw stuff happening. And I think that this needs to be...
And you're doing it yourself? So you're actually seeing the results, like how I am too. Like, I'm like, okay, this is very important that I take accountability and actually do the test so that I can give a real live testimonial, right?
Yeah.
So you are. I mean, you have to believe in it if you're doing it every month.
I know. If I'm putting a tube in my rear end every month.
You're a dude that is married, right? Heterosexual.
To a female.
Right. And you're okay with a tube in your rectum once a month because the symptoms dissipate and the results are great.
Yeah, it's instant. It's an instant feeling for sure.
Okay.
And I used to be a sugarholic all the way until I met my wife. I was just sweets and I was putting in the calories as much as I could, taking naps every day. Just, I could tell a difference in my body until I started to cut that sugar out. So I felt the difference when I started doing those things.
So what can I offer my patients in all the states I'm licensed in? Not everybody lives here in Florida or in Ocala that can come to you physically. So what can we offer them that will at least get them started and they can understand maybe what they're deficient in?
Yeah.
And then maybe we can give them some options for the colonic, any at home type colonic stuff yet? Okay, so they would have to go to a facility, but let's do the testing so they know what they're deficient in, what's causing the asthma, the constipation, the night sweats. Like, I'll let you.
Yeah, so there's a 90-day remote wellness program. And so everybody has access to this. what I've done is I've created a system where providers like yourself have access to this. So it's pretty simple. There's a hair follicle test kit.
Okay.
We ship it out anywhere in the United States. You get it. Let's say you're bald, which is always a question.
Sure.
Because you're pulling from a specific point on the head. So the back of the head where the little small hairs are on the neck, that's where we want the little follicle to come out.
Okay, so there's no excuse. If you don't have any hair on your head, you could still do this test.
If you don't have any hair on your head or even your neck, then the only other point that I want people's hair from, is no lower than this, is the eyebrows.
The eyebrow.
So there's 2 eyebrows from each side. And so it's a German company. This company figured out that there's a certain axis that they're trying to hit where the most accurate information is coming from in the little root.
Okay.
So we can't do beard hair or chest hair, especially not back hair. We don't want any of that stuff.
Or pubic hair.
Oh, I wasn't going to go there.
I'm going to go there because
no.
Let's be real.
We're only assuming we're getting hair from head, so I hope so.
Sure.
But there's a special processing room that we have just for this at our center. So the hair comes back, the kit comes back, pull the hairs, send it back, and then we process it. Within 48 hours of us getting it, the end user's getting the report, whether it's the provider or it's the client directly.
Wow, okay.
48 hours. And then you're getting a 30-page report, which tells you what you're deficient in. Let's say it's L-theanine, and you're like, what the hell is L-theanine? It tells you what it does for the body, and then what you can eat to fill in that deficiency. So it gives you all the foods you need to eat for what you're deficient in, and then what systems are affected. So if you're not breaking down protein, is it adrenals? Is it your cardiovascular system that's low functioning because of it? And which toxins you have too much of.
So I think this would be really cool if I did that test and then we were to come back and like review my results. I'll be raw with everybody to a point. And yeah, we can see.
So think of it like this. Now, let's say you have clients with a lot of supplements. This is where it all started with me, is I had clients come in with bags of supplements and they're like, which one should I take?
Right.
And I can only assume based on their environment what they should take. But if you can now see that in the hair follicle test and see like you're deficient in magnesium, yet I'm taking magnesium, like what the heck's going on here?
Mm-hmm.
It's either the quality or you're missing other things that help you absorb it. So now you can break down your supplement list down to what you need. And we do this every 90 days. That gives your cells enough time
to regenerate. Well, that's like the red blood cells. If I was to pull a test they die. Okay. Every 90 days. Like a hemoglobin A1C is a 3-month average of the blood sugar. And we don't do it at 30 days or 45 days because that's not a full turnover for us to see accurate results.
I love this because my journey since 2014 with this technology, talking with doctors, is like scraping chalkboards because there's not enough progressive doctors that are really looking for alternative things.
Right.
You just said that like it was common sense when I said 90.
Sure.
Nobody else has ever done that to me. That's a doctor.
Really?
No.
Yeah.
None of them.
Yeah.
But yeah, so it takes time for your cells to turn over and to get new information. Also, we're getting a new hair follicle grown at that point. So we're getting new info, new logbook, new info.
It's funny you say that. So I used to be all about traditional medicine. And I started from the ground up. I was a nurse, an RN. Then I went back to school and I obtained my master's and my nurse practitioner. Then I went back for my DNP, my doctorate in nursing practice. And I was still doing traditional medicine. And then COVID hit. And I was on the front lines, and every type of traditional medication was not working. We were looking at whatever we could. And the ivermectin people were trying to they would go to feed stores because the FDA wasn't approving it.
Yeah.
Regular providers, if they are associated with a big group, like a hospital or something, they were not allowed, even if they believed in it, to prescribe this. So you take an oath when you become a provider. If it's a MD, a DO, a DNP, a nurse practitioner, whatever you are you will do the good for the patient and your best knowledge and education.
Right.
So to think outside the box in this crucial time, I had a physician that I was working with, and he believed in ivermectin. Again, we were on the front lines, and he said, "Okay." He said, "We're gonna do this." So I had the sickest patients with so many comorbidities. It's like hypertension, diabetes, COPD. They, have anything from neurological, whatever it was. So they were on tons of medications. So we went ahead and we implemented the ivermectin and we would see the change, or we would try other medications and we would see them improving. That opened up my eyes. Like, there's got to be something else out there. Then I was introduced to the GLP-1s, which are a peptide.
Right.
People don't understand. This peptides you make that normally in your body. This is what your body orchestrates, and they're the messengers. There's so many other peptides out there. There's so many great supplements if you're missing it, but there's also other things that could be introduced to your body that can repair the mitochondria, the engine in your cells, rejuvenate them, reset. Like we were talking, this epigenetics, you think that you're predisposed, and in the beginning of our conversation with the twins, you can separate their environments, what they're exposed to, also what they're taking in their body, and what they're being taught and raised in that lifestyle. And you'll get two totally different outcomes.
Yeah.
100%.
Yep. And I think for the first time ever in our generation, first time ever, in general, we're able to, on a cellular level, tell our body what to do with these peptides.
Turn them on, turn them off, turn them on, turn them off.
It's so cool.
Yes.
And they're trying really hard to the higher powers are trying really hard to not give us access to those the way
they're
we
realizing.
should.
I know, but I think they're finally.
They have to.
Yeah.
Because they're realizing that people are figuring out ways around it. And I think that, insulin is a peptide. Nobody's ever known that.
It was the first peptide. And I bring that up. I bring that up a lot in my podcast. That was one of the first peptides. Everybody knows what insulin is. Do you know that's a peptide, you guys?
Yeah. And they're
it's
like,
a peptide.
Oh, wow.
Yeah.
My wife's a type 1 diabetic. She's been one for many years now. So at least 20 some years, and adult onset. So I learned so much just from her on what works, what doesn't work.
Right.
And there are, besides insulin and maybe the GLP-1, I feel like they're getting better with the GLPs, with the retatrutide and the newer ones that are coming out.
That'll be coming out, in 2026.
So they're getting better with them. But really, there's not a lot of harm you can do with the peptides, the typical ones that we have access to, not the insulin and GLP-1s.
Sure. Under a medical provider supervision.
Yes.
So there's a lot of pop-up spas that will come in, and there's not a medical provider there going along and monitoring. You really need to monitor, because it can affect you in the long run if you're not taking. And microdosing is a beautiful thing.
Microdosing, for sure.
It's fantastic just for a normal person that's in great shape and they want to bring down their inflammation. So, like I was saying before, going back, introducing things, educating people, the public, about these different tests that we can do. And then we actually they're not medications. They're an educated protocol, right? Or supplements, peptides. So here we are, we're giving you the test, we're telling you what's wrong, and here's the answer. It's fantastic to be able to do that now.
I don't want to go too far into peptides because we'll be here 4 hours.
Yes.
We have limited time, but I just want to say, so that is my overall goal with this testing as well, is the epigenetic hair follicle test, what's in your cells, and the HRV test, which is physically how the body's functioning, but also it shows me what genes are more active at the time, overstimulated. And we need to know which ones to turn on and off. We need to know what systems need support. So we're working towards creating suggestions on which peptides you need, or amino acids, because using the body's feedback to figure that out.
Sure.
They have not figured that out yet, how to do it precisely to be able to say you need this specific peptide in the body. But once they come out with that, that's going to be a little bit of a game changer if they ever do.
Yeah. So they're doing studies. For example, the NAD peptide with Alzheimer's patients, it really improves your mental clarity and your cognition. Makes you so much more sharp, just processing, retrieving information. It also increases your energy level, like all day.
Yeah.
You'll be you're not going to get this like horrible boom and go down or fall flat on your face when it's 7 o'clock at night. If you've been up all day, that's been fantastic. Just for me, even personally, I feel like I'm really sharp now.
I used it right before we came here.
Did you?
I did, yeah.
Yeah, I do the troches because I'm not a big like injection person.
What are the trochees? What's a trochee? Is this some fancy term?
Well, a trochee is it can come like in a circular square and it just dissolves in your buccal, which is your mouth, the lining. So you just suck on it.
Yeah, okay.
And then you want to make sure they're liposomal, because liposomal, they'll kind of work with your enzymes and everything so that it will go into your bloodstream and your gastric juices won't like break it down, and then you won't get what you need from it, right? So you won't lose like a percentage of it. They're fantastic. But that was just like a side little plug. No, but for example, that peptide is being studied and utilized in Alzheimer's patients and other patients. So it's just a matter of time before that becomes something that I don't know, I hope everybody around the world is familiar with, like a GLP-1, and is like, oh my God, I want that. I need that. It repairs your mitochondrial. There's the BPC 157. It's fantastic, but that's under RUO, which is research use only right now, because they haven't had enough human subjects to do these studies and for them to have the statistical analysis to release it out. They've done it on animals, really, but that's great for healing of your shoulders, your joints, muscle tears, whatever, injuries. I can go on all day. Like I know. Saying.
And I'm seeing it with people that are using peptides. I'm seeing the data.
You are.
I'm seeing the changes. It's super cool. People that are dealing with huge inflammations using those peptides and microdosing.
Sure.
And then going back a month later and rechecking those inflammation markers and seeing the drastic drop. And everybody's different, so it doesn't work for everybody. But when you hit that person perfectly, it's a dramatic difference.
So the thing is, like you said, I think it will work for people, but you have to look at their cortisol level. In other words, their stress. And because peptides don't work if you're overproducing cortisol, or they won't work as well. So with my patients now, November, December, they'll be on GLP-1s, for example. And they're like, I'm not losing as much weight. I don't understand. I don't feel it. And then I talk to them and walk them through this. First of all, you're totally being exposed to all kinds of candies and cookies and cakes and food that you normally wouldn't. Your environment, having more parties, doing all that. Your stress levels through the roof. You're hosting or you're traveling, right? For the holidays. Yep. And you have this pressure for Christmas and gifts and financial. It's the end of the year, quarterly bonuses. Everything has to be wrapped up and done and tucked away. So if you're not sleeping well, peptides aren't going to work as well. If your cortisol's up because you're beyond stressed, peptides aren't going to work. If your environment has changed, it's like a little bit of a crisis, peptides aren't going to work. Let's move away from the holiday time. And just in general, I always look at the emotional and mental. That's my first thing in labs with a patient when I talk.
How do you do that? Do you do a saliva test or blood test?
Blood.
Okay.
So I'll do a blood test. I'll look at their kidneys, their liver, their thyroid. I go through everything. We can go even more advanced hormone replacement therapy. So I'll be checking all their levels, their testosterone, their estradiol, so on and so forth, cortisol. And then I'll talk to them and I'll sit with it. And it's so important to take your time with a patient, a client, and find out who they are.
Yeah, I agree.
And that will unveil a lot of things of why possibly your supplements aren't working, your peptides aren't working, your diet's not working, your colonic, even if you get everything out of them the next day, they're going to be full again. Why?
Yeah.
So it's a behavior thing. Are you triggering yourself? Because people are like, oh, I get triggered because of this. You have to understand, and I'll close out with this too, with epigenetics. We're above just the regular genes that we're built with, right? We can actually control this. You have to rewire your brain and say, okay, I want to change my life. I may be predisposed to be like my mom or my dad. I want to go higher in my career. I want to feel sharper about my cognition. I want more strength on my bones and everything in my body to kind of align. But that's up to you. So that's the first stage. Let's have a talk. Let's go from there. And then let's see what your candidate. We always would look at patients who they have polypharmacy. So they're on too many supplements. And that's basically what you're doing too. People are coming in with this huge thing. I'm on every single vitamin in the world. And you're like, no, what are you doing? First of all, who the heck wants to take all those?
I don't know.
I don't. And who has time? I don't have time.
They don't need time. They just do handfuls.
I know, but and that can tear up your stomach.
Oh yeah, for sure.
So you need to see exactly what you need. So I would love you guys. I'm totally encouraging you to reach out. I was going to say, reach out to Reboot. So reach and you'll remember it. Reach out to Reboot You. So Reboot You, I'm going to leave Fabien's information so you can even talk to you personally, right?
Yeah, absolutely.
And you can reach out to me on yourvipdoctor.com. You can reach out for a consultation. We can go through it. We can get the hair follicle. We can start you off and see what you're deficient in.
So just to kind of run through that real quick again is the IDEA method: identify, detox, enhance, adapt. So what we can do anywhere in the United States, we send a hair follicle kit, you get a report, then you know what's going on.
Okay.
Start nutritionally helping your body and with supplements.
Tell them.
Number 2, detox. So that 30-day detox kit, we have access to ship that to you. So then you just have to find somewhere that does colon hydrotherapy, a closed system colon hydrotherapy session. Then you do the detox with the colonics, and now your body gets a whole reboot after 30 days. And then we create custom compounded supplements that are whole food for your body based on your epigenetic test. So that's the enhanced part. So the next 60 days, we're focused on once a day, you make a shake out of it, you put it into a smoothie, and you're getting what your body's logbook is saying it needs, which is these 15 nutrients, and it's specific to you, your name on it, your formulary, everything. And then you rescan in 90 days. So it's a whole process that everything else that you guys are doing in your practice, and you're doing with your clients for the hormones, for the mental state, neurological balancing, we're just focused on the nutritional side and cleaning out the body from the toxins so that everything that you're recommending is even more amplified because the body has a better chance of going like, okay, this is all good stuff. Like, let's learn this and stick this way because it's working.
That's great. You did. You summarized it. I'm just sitting here. I'm like shaking my head. I'm like, yes, that's right. It's fantastic information. It was a pleasure having you come here. I'm very excited to, work with you and kind of partner. I think it's important. This is so needed. Thank you.
Pleasure meeting you, Danielle.
You too.
Thank you.